afternoon, everybody, and welcome to Zahn Academy in the lab series. Today's series is on 3D printing art class level 1, and we are very happy to have Jessica Birrell, CEO and owner of Capture Dental Arts. Jessica is a CDT, MUA, and most of all, a mom. And she is our presenter today. So Jessica, thank you so much for joining us, and everybody enjoy her presentation.
Thank you. I believe we have a lot of people online joining us today, so I'm glad everyone's just as excited as I am to discuss, first of all, art and color, but also combining it with 3D printing. Just want to thank Zahn again for hosting this webinar today. I'm going to take you through a couple techniques, and then at the end, we're going to go through how to customize everything. Okay, and then we'll leave some time for questions. So when I left off, I think those of you who know, we're opening our new center. We just moved in March, so we're super excited. Here it houses our laboratory, a new dental clinic, and an education and research facility where we're also combining medical and whole health. I love art. So this is going to be a series. This is level 1. We're going to start with some of the basics on how to customize dentures and add color. And then I believe we're going to do 1 to 2 more levels. It just depends on the demand that you have and what additional needs are as we progress in learning how to customize dentures. If you don't do dentures, don't worry. We have plenty of things we're going to show you today. So one of my objectives is, for this webinar, knowledge of our printed options. We're going to go through a couple printed options that we work with customization. We're going to go through the process today on how we characterize. So we're going to really dive into the step-by-step technique on how we paint and customize dentures. And then we're going to go through the basic colors and proper applications, because there's a lot of ways we can customize dentures and some of our printed restorations, but there's also a lot of wrong ways. And then I hope by the end of this webinar, you gain confidence in how to enhance natural characteristics. So as you can see here on this denture, on the left, we have just a base printed denture. And on the right, we've got these color modifiers that I'm going to show you today. And they don't need to be crazy. That's one thing that I've learned. As a technician, we love to add veins. We love to add all these different colors. But this is actually a very simple addition of just 2 to 3 colors. I'm going to show you this today and also emphasize, please do not over characterize your dentures unless you've got some patient that's their demand. Most of the time it's just a few subtle details and it will look really natural. The materials that you need to get started with 3D printed dentures and customization, I work mostly with 3Shape and ExoCAD. I know InLab, you can use InLab. I don't know how compatible that system is with the Envision One and the Einstein printer that I'm using. I have the Envision Tech 1 originally. We just got our new Einstein, so you're going to be seeing a lot of videos coming here soon on social media. The resins I like to use are the Flexera, and I'm sure some of you have already heard me talk about Flexera. Flexera is a great material. It does have some natural flex to it, which means it's not going to break as easy. It does have some forgiveness and play in the material that it can bounce back a little bit, stretch out a little bit. And you'll see with our partials and flippers, it has the ability to act similar to a Duraflex or Valplast. The resins you'll want, I do encourage you to get all the different variations in colors with both the base and the teeth. If you don't want to purchase all of them at once, at least get a couple common colors, such as A1 tooth resin and maybe an A2 or A3, so you can use them as color modifiers. For the bases too, I'd recommend a light pink, original pink, and a dark pink. That way you have some options for modifying. So usually you go with 1 light, 1 middle, and 1 dark. If you can't afford them all and you're slowly building up your stock. A curing unit. The Autoflash we've discussed before is a really good curing system. And to me, that's just my insurance policy. It guarantees that what I've printed is cured properly so that it will maintain that longevity that Flexera has been tested for. So I can't stress that enough. Be very careful with the curing units you use. Not all of them are the same. Some of them produce too much heat and can damage your printed restoration. Another product I'm going to introduce to you today, if you've not used it before, is Nexco. I love Nexco. I was introduced to this product, I think maybe over 10 years ago at Ivoclar's facility in Liechtenstein. And it's just a composite resin. You've got stains, you've got paste, but I really like to use the Nexco stains. And for those of you who have not heard of Nexco, it's very inexpensive and works well. One thing I love about Nexco too is it polishes to a really hard shine. It doesn't matter so much in this situation because we're going to place it internally, but there's less porosity with this material. It's a reasonable price and the color palettes are perfect. Some additional material you're going to need are brushes. There's a couple different types of brushes. I'll show you one I like to use. You'll want gloves. I highly recommend gloves. I always forget I need gloves when I start this process. And if you get this resin on your hands, you'll know it's sticky. And most of us think we can use a little bit of dish soap, something that helps remove grease. It does not come off easy with dish soap. You have to use alcohol to get it off of your skin. So do yourself a favor, put your gloves on first. Make sure you have a nice clean area that's dust-free, clean brushes all ready to go before you start the process. Another option is a light protective case. I'll show you a couple different cases that I use to keep the resins in while I'm working with. You'll want some Burrs. I'll show you some Burrs I like to use, and keep some rubbing alcohol on hand. Those of you that have worked in a clinic, you can get a little alcohol dispensing pump container that the doctors use that you can just push the top of it and it will bring some alcohol up to the top of the surface, which you can use with a cotton swab or whatever, or on your brush to clean your brush. And that will allow you to clean up the area. And then also when you're done, remove any excess shine. Okay, this is the system that I'm currently using. Like I said, we just got the Einstein, which I'm so excited. It produces faster print with the heat that it offers. It also has a really high level of clarity with very minimal texture, surface texture. And it also helps ensure the strength of this material. Flexera will talk a little bit more about their new product if you have not heard about their Flexera Ultra that was just released. I love their cleaning system, their Envision Tech Wash. I recommend that you get some type of washing unit. I like to have two, one for my dirty and one for my clean bath, because you do need to give this material 2 baths after it's been printed. And then the Autoflash. This I just wanted to show you with the new Einstein, this NanoFit 385. Look at the image on the left versus the image on the right. And this is the advancements that we're seeing with printers on the market right now. So increased clarity. It may not be a big deal when you're working with dentures, but for me, it absolutely is when we're printing teeth. It's less polishing, less finishing work at the end to have a smoother surface. So look at the new technology. If you've not checked out the new Einstein series, it really is exciting where technology is advancing. Not only is it better in the texture with minimal texture, the clarity is much better. So clarity is a big deal when we're looking at customizing, and just color integrity. If we're not careful with our printing system and our curing system, we can alter the colors of the resin, which is not good when you're working with teeth and you want an A1 and you get more of that amber effect like you see on the right-hand side. Also, with this new technology, the fit is incredible. And I love to show this video so you can see how accurate the base and the teeth can be. And when you go through the new design process, the fit between the teeth and the base, if you know how to design that properly, there's almost little to no adjustments to get these teeth to seat into the base. So for me, it's definitely been a playground. I'm sure a lot of you have heard me say that printing, I feel like I'm just cheating, and I love it because we're not compromising on aesthetics, but we are really simplifying our process. When we look at what options we have for printed restorations, today we're going to talk about what do we customize and how can we customize them. So some of the options we look at that are printables that we can customize and add more character by painting them or staining is partials. We've been doing a lot of our partials now printed. If they need metal reinforcement, we've been playing around with this technique with designing a metal frame, scanning it, and then printing over the top of it and embedding it into resin. I think there's a couple other labs that I've talked to that are testing similar things. Flippers is one of our go-tos now. I love making flippers, especially if you're just a crown and bridge laboratory. Flippers are an excellent option for someone who's going through an implant or they just got a tooth knocked out. You can easily design a temporary flipper. I like to say temporary, but they're not really temporary. With Flexera, it was FDA approved for permanent use. So as long as they're delicate with these flippers, meaning that they're not letting their dog chew on them or they're not stepping on them and they're not soaking them overnight, they should last a very long time. But designing flippers in the software, we can mirror a tooth like a single central or really easily replicate a customized tooth shape where denture teeth, we have to try to find one and reduce it and contour it to look like this rounding teeth. Digitally, we can design it to be exactly what we want. So that's why dentures and flippers and partials are so incredible with the digital process. We can enhance those aesthetics a lot more. So flippers, if you're crown and bridge, I highly recommend you look into flippers. They're not as complex as dentures. Dentures can be a little over some heads of crown and bridge technicians. Some other options are temporaries. We've been printing all of our temporaries, including full mouth temporaries now. I'd love to see doctors start to print their temporaries chairside or permanent crowns. They've been an awesome option with the margins are just so much better than what the dentist can produce with their chairside temporaries. So you can customize temps. You can stain them with the same technique I'm going to teach you today. Same with the permanent crowns with the new resin that I'll introduce in just a minute. And another really fun process, because I know most dental technicians love to play around, is Billy Bob teeth. You can easily take digital scans or Zahn carries an alginate that's scannable. You can take an alginate impression, scan them, design tissue and teeth overlays, print them in a matter of minutes, and then customize and shade them. So I'm sure this Halloween is going to be fun for a lot of laboratories because this process to make fun Halloween prosthetics is so simple now. Okay, so I'm just going to talk about a few notes with flippers and partials because when you're designing them and you're looking at printed options, you have to be careful because it's a little bit different than the traditional flippers and partials that we make by hand. So this is the 3Shape software. When we're designing flippers, you want to pay, or flippers or partials, you want to pay attention to the clasps. Keep these clasps really thick. I think the software tends to let you go to almost 1 millimeter in thickness. Sometimes you can push it over the thickness point, but I like to go through and take the add tool and just add everywhere and really thicken them up because I can easily reduce them down after printing, but it's a lot harder to add to a clasp without getting distortion after it's been printed. Clasps, if they're printed too thin, can have some distortion. So keep them thick, keep them rounded, and remember these flex a little bit. So since they flex, you can actually get into those undercuts and you can add larger clasps that can go over the tissue and they're softer to the surrounding tissue, which has been awesome. I just seated a denture, or sorry, upper denture, lower partial that was printed this week. And the patient had a lower partial, just a few anterior teeth left, and she has not been wearing her traditional metal partial because of how much irritation it causes to her anterior teeth. We printed her one, and when it clicked into place, she instantly said, "That feels amazing." So these flexible clasps, they're flexible. They're not quite as flexible as a Valplast could be, very close to it. If you take them too thin, you'll get more flex, but be careful not to take them under 1 millimeter because you can easily break them or cause them to distort during curing. So thick clasps, you can see here how far we can wrap these around. Sometimes we've just been creating window cutouts, so they just slide over the existing teeth. I've had a patient break almost every Duraflex Valplast that we've made for him. I think he has like 4 lower anterior teeth left. So I just made a window with a printed partial that just clicks in over the top of his surrounding teeth. So you can do that very easy with this material. I don't typically block out undercuts when I print. I adjust those a little bit after printing. I want to get into some of those undercuts with this material. So just remember thick, rounded clasps. Bulk them out a little bit, especially during curing, because curing can cause some heat, and that's where a lot of people get distortion on partials and flippers. Also pay attention to the flexing areas. On lower partials, this area right here where the canines are at the lingual side, you can imagine the patient trying to pull that out of their mouth. They're going to grab their left and right sides and take that and try to pull that out. So think and analyze, where are those flexural points going to be, and add extra thickness. You can even add vertical lines of thickness that will help absorb the pressure and the strain that's placed on during removal. And remember, the patients are hard on them. They're not going to think about trying to be delicate with clasps. They're going to grab them with one finger and put all their pressure and try to flip it out from one side or the other. They don't think about flexure. So really go in and try to add stabilizing thickness in any area that can flex. Okay. Let's talk about resins for just a minute. I'm so excited for the new breakthrough resin, the Flexera Ultra Plus. And this is the one that's been FDA cleared for permanent restorations and minimal prep veneers, which I love. As a cosmetic ceramist, I love creating minimal prep veneers anytime we can stay conservative. Our biggest challenge right now is zirconia is cementable, Emax is curable, so you can light cure and bond. When we're working with minimal prep veneers, we want to bond to enamel. And now this material allows us a printed option that is bondable for conservative veneers, which is awesome. I love the look of the multi-layered zirconia, but it doesn't quite have the same bonding capabilities of Emax. Now Flexera brings us a bondable material for minimal prep veneers. I love the color options that we have. So if you look at our colors here, we have a light pink, medium pink, orange pink, dark pink, and Meharry. And then we've also got our 2 shades. Now, the cool thing about printed restorations is it doesn't really matter the 2 shades so much. You can tweak them and customize them with this technique I'm going to show you. So if you have, just pick something close to the shade range. Get an A1, get a bleach, get an A2 and an A3. And then that way you can go A3 and stain it down, or you can go A1 and add A2 at the gingival with the shadings that I'll introduce. So it is customizable, which is awesome, because if you get in the patient's mouth and it's a little too bright, you can easily tone it down chair side, or teach the doctor how to do that so he can avoid sending it back to you. Okay, color modifiers are really fun. There's a couple different variations I'm going to teach you. There's a lot out on the market. And like I said, I really like to use the Nexco system because Nexco, it's inexpensive. The colors are accurate and there's less porosity to this material. So when you use this material by itself with their gingiva materials, it does, you're able to hand polish it to get a really high shine. However, with this material, we don't want to place it topical. And that's one of the mistakes people make, is they take composite stains, place it topical, and then put it in the patient's mouth. Those will wear off over time. So what we do is we place these stains and then take a little bit of tooth resin after we cured the stain and place tooth resin over the top of it. And it seals that in place. That way we don't have to worry about the stain wearing off, and then we're maintaining that same strength of Flexera on the external surface. So the main colors I like to get are red, chili, orange, blue, and mahogany. Orange is going to be the one that's our main shade modifier. If you thin it down, it's almost a yellow. So you can get really light yellows. You can still get into some of your Bs. You can use a tiny bit in with bleach shades. Blue, if you want to add some blue up around the highest points of the gingiva, right before it connects up to the lips, sometimes we see blue. You can also use it to enhance incisal translucency on natural teeth. I'm going to warn you though, I've got carried away before with some of my dentures. I thought this is awesome. I'm going to add mamelons. I'm going to add this beautiful blue border and halo. I feel like when you hand polish them, you can add a little bit of a white halo, maybe a hair of blue, but you really don't need to get carried away painting in a lot of mamelons and a lot of detail. Sometimes you can get into trouble because they are pigments and they can be pretty strong. So be careful, and remember you will be placing a thin coat of the resin over the top of them. I think we like to overcomplicate it anyways as technicians. Definitely if you're working with a single central, you can cut back a printed single central, stain in some material or some shading and colors to get it to match the natural teeth, and then coat that with some resin. So you can get carried away and match natural surrounding teeth. That's definitely possible. But if you're working with a full denture, you really don't need to get that detailed unless, like I said, you like to overcomplicate it, which tends to be a lot of us. So this is one of the brushes I like to use. This one you can buy from Ivoclar Vivadent. You can also get some from Zahn. A lot of people carry these little brush that have the disposable tips that go into it. I highly recommend you use a brush like this. When you're working with resin, it will set up, it will cure, and those brush tips will harden out, and then you're constantly cleaning them with alcohol to remove the resin. If you're getting these disposable tips, we reuse them as long as we can, but when they start to get gummed up, just throw them away and grab another one. They're really inexpensive. So Ivoclar has them, Zahn carries some similar. You can also buy them on the clinical side as well. Another little tray I like to get is just this light curable tray. This is from Ivoclar also. Zahn may carry something similar, but you do want to get one of these trays with that light protecting shield over the top of it so that your resins don't harden with the surrounding light, and same with the Nexco. Nexco will become hard over time. Now the stains from Nexco don't dry out as fast as some other brands, but the gingiva, if you use the gingiva material, it will dry out pretty fast or harden with the light. So this one's from Ivoclar. And then another one I found is on Amazon. It's such a cool little contraption. This is the brand that I found. I wish it had multiple layers, multiple wells. And I thought I seen one a while ago from a company. If anyone finds that, let me know, where it had stackable trays, stackable wells. But this one has the lid that clicks onto it. This one also has heating options if you're working with just composite, like a dentist, or you're doing composite buildups. When you warm the composite, it softens it, so it's easier to work with. I don't work with any of the composite, so I just work with the stains because all we're doing is adding character and then adding resin back over the top of it. But this is what I use in my lab, and it's a pretty cool little contraption. So one thing we want to look at, as I mentioned, we like to make sure that we put the Nexco or your composite stains internally. And the reason why is this material, Flexera, is less likely to stain. If we're putting composites over the top, they can hold stain and bacteria at a higher level. So we want to coat any composite staining or shading we're doing internally and place, even if it's a thin layer of resin over the top of it, to seal that in. Okay, so let's talk about color applications now. This is my favorite part because I love art and I love painting and I love a fresh canvas. Color application is so fun with printed dentures and printed crowns, just printed restorations in general that need an extra level of characterization. One reason I love the ability to add color, for instance, this patient I seen this week, the gingiva was just slightly off in shade. And when she smiled, the clasps were visible, even though we wrapped them around. But having the ability to go in and customize and add a little bit of color really helps them blend in. And my main reason for doing it too, yes, it gives us the ability to feel, as an artist, we're satisfying the artist in us. But it also allows our patients to really feel this customized personal attention that we are making this just for them. So our patients feel that level of love and care when we are able to characterize these and give them that individual uniqueness. So as we look at these dentures, I'm going to take you through the process and how to apply the shading. At the end, like I said, we'll leave some time for questions. Hopefully I don't talk too much because I have a tendency to go over. So it's a pretty simple process. When we get our denture and we put it in our curing alcohol bath, give it time to breathe and make sure, I usually print mine, cure them, and leave them overnight. Then it's ready to apply the stains. If you're doing it right away, you can put it in a warming oven. I think it was around 35 degrees Celsius or so, like 110 degrees. don't start, don't start on it right away if it's just coming out of that alcohol bath. I'm gonna set up my stains, and I usually use chili red. Chili is a little bit more of a vibrant red. It looks a little bit more like fresh blood, those nice veins that we get. Their basic red is a softer red, a little bit darker, and orange is what we use at the neck for any shading. So when you look at the denture, you don't need to paint little tiny detail everywhere. When I'm applying this, I use those little disposable brush tips or an Explorer. You can use a couple different things to apply these. You'll get your stains out and get them ready. Like I said, use those wells. That way you can just put the light, the orange lid over the top of it to prevent the light from penetrating, and leave them in there, and they'll last a long time. So that way you're not wasting material too. So I get my material set out, and then we'll get ready to apply it. And like I said, you can use a brush, you can use a stain brush, you can use an Explorer. Sometimes I grab an Explorer and use that to pull the stain through to add some veining if you want more detail. And then you're just gonna pick up this material. I usually go with a darker red first and go into all the concavities. So just start brushing it in there. And I can tell you the first time I started applying this, I overcomplicated it. I was trying to paint it on there so pretty. You can be fast. And I think sometimes when we're faster, we end up doing our best work. So just add a little bit into all the concave areas in between the teeth, so we can add some shadowing, making the roots or the apex, the highest point of that cervical area, look elevated. So we're adding shadowing right now. Like I said, don't make it fancy. I don't usually add staining up around the border of our denture. Sometimes we need to adjust that chair side if it's too thick for the patient. So really we just need it just going up high enough to where it's covered under their lip, and then blending, fading in. I also like to add a little band over the cervical area. You can see over the root, just adding a little bit of shading. Any point you can go ahead and cure this if you want to, but just go ahead and add your darker colors in, fade them in and blend them in. I usually use both variations of red to mix it up a little bit. You can also add some orange in this area. You can add orange at the neck. You can add some blue up towards the top of the denture. You can add this orange now at the neck of the tooth to add a little bit of shading. Be careful not to get any pink around the neck of the tooth, especially if you get the pink down in between the teeth and approximately, it starts to look really fake. So you can easily take a dry brush and remove anything that you don't want from in between the teeth, but avoid getting any red or pinkish hue in between the teeth. That's one thing to note too when you're gluing the teeth in. I glue the teeth in with a tooth colored resin, not the gingival resin, because I don't want the pink to get too far in between the teeth. It helps them look separated. So once you get this color on here, if you don't like it, it's no problem, wipe it off. It's really easy to adjust this. The mahogany you can use if you want your tooth a little bit darker, so you can get into those 4M1s, 5M1s, those darker shades, and just play around with it until you like how that looks. It's not gonna look super pretty just yet, but once we put the resin over the top of it, you'll see how all of a sudden it just comes to life. So this mahogany, like I said, you can use for your 3Ms, 4Ms, 5Ms, your darker shades, even into some of those Cs and D shade ranges. And then just play around with it until you get it to where you want it to be. Let me get it focused. And then that's about it. And then we're gonna cure this in. Now there's a couple different curing units too. I thought it was annexed in. I seen someone once that had a curing umbrella. If you find that one too, let me know. It's a curing light that's on a stand, and you can just touch it with your pinky finger to have it activate. And that way you have both hands free. One option I like to do is keep my light curing unit on a stand. And when it's on a stand, I can just keep my hands free, turn it on to activate it, and move my denture underneath this curing light to harden the stains as I'm going. Especially if you want to build multiple layers of depth, you want to get your darker areas there first, cure it, and then you can keep adding more detail over the top of it. Especially if you want to get veins in place. You can take your Explorer, drag it through, make some veins, cure it so it doesn't move, and then keep adding more color until you're satisfied with it. Amazon also has these cool shades that are these big orange shades so that you have eye protection. You can use them if you don't have a shield on your curing wand. I don't really like to use them because I feel like it distorts the ability to see the color. So I just keep the shield on my curing light. But there's a couple ways you can do it. I just give it a 5 to 10 second cure until it's hardened in place and it's not moving around. Now I'll note this denture has not been cured since printing. It's been printed, it's gone through the bath, all the alcohol's had time to breathe, and now we're applying the stains, and then we'll put it through the entire curing process at the end. Now these are some of the different colors that we have here. If you notice, I have some of the tooth resin and then also some of the gingival resin. I like to fill up a couple different variations in my well here. That way, and then I'll just keep this lid on it and store it. This lid keeps the dust out of it, which is tricky when you're working with composite because it can be sticky. And I feel like dust is just attracted to our stains anyways, with ceramics and with anything composite. So we're gonna go through some of these colors here. This is light pink. We've got original pink. We've got the medium pink, dark pink, and then the Meharry. I really like light pink lately for flippers. I also leave a tooth colored resin like A2. That way I can warm up the gingival of the tooth, or if it's an A2 overall, I can use A3 and add a little bit of resin over the neck to seal in my shading and warm up the color a little bit. So no, you can use whatever color you want to either lighten or darken it. And I'm just gonna place a little bit of that tooth resin over the top of the tooth to seal it in. If it's a bleach shade and you want to keep it light, seal it with bleach, whatever shade your overall desired shade is. You can add a little bit of blue. You can add a little bit of white around the incisal if you want to give it a little bit of a halo too, and then just seal that with a thin amount of resin placed over the top of that. So you can get pretty detailed. And like I said, you don't really need to though, just a little bit of warmth and depth in between and all those concave areas. You can add a little bit of orange on any of the elevated areas. But once you have this cured, we're just gonna take this resin and then just place a little bit of resin over the top of it. Now you can add more character when you're placing this resin over the top too. Notice how I'm placing bands right around the neck, and this is with the light pink. I'm just taking a little band and placing it around. And then you can go in between, give it a full coat. I'm always worried that I didn't coat it well enough. So I like to give it one quick coat of the Flexera base and then cure that. And then I play around and add more detail. That way I know I coated all of the stain and sealed in. And then you can get into customizing and adding a little more character. So give it a quick coat. You can cure that if you want so it doesn't slump. This material will slump. So it will start to fall over the neck of the tooth. You need to take your brush and go back around and wipe it away from the neck of the tooth. This is when it's nice to have a curing light on a stand because you can hurry and move the resin around and put it directly under the light to stop it from slumping and get it to stay in place. So you're gonna go ahead, add a little bit of resin, seal in your stain, and then we can even get into some texturing. But you can see already how this looks just by adding this resin over the top of it. Just be careful, like I said, it does slump around the neck of the tooth. So we'll go in and remove any excess right before curing. Get that to focus, there we go. I'll have a full video of this. We're gonna launch on YouTube this weekend at Lab Day West. It's free for everyone to download. You can also check out this Zahn video again. But this video has a little more step-by-step technique. So you're gonna cure this on there. Once again, you don't need to cure it long, maybe 10 to 30 seconds. It will harden this material and then you can go in and add more detail and customize more. So if you wanna come in and add some texture, you can come in and refine these bands. I love to go around that gingival band, cure it really quick so it doesn't slump down and add those elevations. So think about that when you're printing it. You can get some detailed designs if you want to design the gingiva in the 3D software. You can design it, add all those characteristics in there, but you can also add it in at the end. So whichever area you want to spend your time, you can add more detail in designing so you have less detail to do at the end, or at the end you can go in and add some elevations and texture and play around with some of the different characteristics after printing. So I like to take my lighter, I go over all of the elevated areas. You can also use the tooth colored resin on that gingiva band to give it the appearance of translucency and fading right into the neck of that tooth. Keep it a little bit lighter and cure that. And then we can go in and add a little bit more detail. Now, for those of us that like stippling, there's a couple techniques too that we can take our brush and just pat it in with our brush and create a little bit of stippling and cure that. I like the brush because the brush doesn't make deep pits. And honestly, when it comes to stippling, we really don't want a lot of deep texture because bacteria is going to stick to it. We're going to have plaque build up. So we want to keep the texture cleansable. So little divots, little different areas of elevation, but not really deep pits. And the brush, I feel like, really lets me get in there and just stipple and give it a little bit of variation in surface texture without being too dramatic where plaque and food can adhere to. So like cure that, you can get some detail in, and then that's really it. Like, this is a very simple process. And if you, once you get the hang of the technique and how to get it on there, I encourage you to work fast because your mind can see what you want it to look like. The longer you play with it, it just gets muddy and you start to lose all that detail. So really simple process. After all of that's applied, we're going to place it into our Autoflash curing unit. And this is, like I said, I don't use anything else at the moment. I do wish this had a larger compartment. And I know everyone just says buy more Autoflash curing units. So we at some point may have like 5 to 10 on the shelf so we can cure a bunch of units. I can really only fit one denture, maybe 2 partials or 2 flippers in here at a time. But we're going to place it into the Autoflash. We're going to put it on 3,000 cures and cure it. And one important thing I just learned is to make sure you open the lid after and let it cool down for a minute. All heating units produce, or all curing units produce heat, especially when you're printing a flipper. You can cause those little clasps to flex and possibly distort. So cure 3,000 cures. Open the lid, let it sit a few minutes to cool down. You can even take it out, let it cool down for a minute, flip it on the other side and do another 3,000 cures. And then it's ready for polishing. But let it cool down. One thing we learned too with partials and flippers is if they're very thin, take them out of the curing unit while they're still warm, put them back on the model and hold them there until it cools down. We've tried all different variations of techniques, rubber banding them to the model. Usually we just place them back on the model, hold it in place, and even take the air gun just to blow on it to let it cool down while we hold it in shape. Especially on those clasps, because the clasps have the tendency to pull away if they're thin. So hold the clasp in place and then cool it down, and then it won't lose its shape. And you'll be surprised at how nicely these click and fit onto the model. So 3,000 on each side, let it cool down. And if it's thin, put it back on the model for the final cooling process. Now there's a couple burrs you can use. These are from Comet. They're just some little polishing bristle brushes I've showed a couple times in other lectures. You can use these to get into some deeper areas when you need to reduce or contour aggressively. The darker or the thicker the bristle are, the more material it will remove, or the more aggressive it will smooth the surface. I usually don't need to use these because I'm contouring the denture before I apply next coat to make sure I've got it where I want it. If you need to add a lot of elevation with the resin over the top of it, maybe reduce the denture either in the software, the 3D software, or by hand before you even apply any next coat shading. So there's a couple different burrs you can use, and I want to show you if you cure it right, emphasis on curing it right, it will be hard enough that you can hand polish. And I prefer a hand polish over the top of this Flexera. If you're adding one of those like seals over the top of it, like a lot of people have different, there's a couple different brands on the market that you can just paint a shiny seal over the top of it. Those can wear off in as little as 3 months, depending on the patient's pH. So if I can get a mechanical shine, this is maintainable, especially if they come in for another cleaning, it's dulled down. I can take this cotton buff and just go back over the surface and polish it back up. So I prefer a mechanical polish, not the addition of any polishing paste or sealer. However, those sealers are awesome to hurry and get a shine when you're in a hurry. I do use those seals on temporaries. If it's just a quick temporary, I'll mix the next coat into my seal. Like I have Glisten. Glisten's one product that we use for temporaries chair side. I'll mix the next coat in with it and apply that and light cure it, and I'll get a shine and color all in one for a temporary solution. So if you take this cotton buff, notice this is the side that's just printed. You can come in here and polish that and get a really high shine just by using a cotton buff. You don't need something really hard. And that's the problem we make in polishing, especially as technicians. We love to grab that burr and just push the heck out of it and try to polish and shine really aggressively. You don't need to do that. You can put it on the lathe with pumice polish. That's what I'll usually do, just to make it sure I've got the texture as smooth as I'd like it to be. Use water and pumice, and don't push hard. If you push hard, you'll heat it up and you can distort the surface a little bit. Once you put it on the pumice polish, I clean it off. You don't always need to pumice polish it if you were careful when you applied your Flexera over the top of your next coat. After pumice polishing, you can go in and just use that cotton buff. If you need to use anything more aggressive, you can use the white goat hair bristle brush. That will help get rid of some uneven pits and reduce slightly. But the problem we have is we push too hard. So do not push hard, just a light cotton buff, go around and lightly shine it up until you're satisfied with that sheen. So that's gonna be the biggest trick for you, is don't push hard, don't go too fast, just really light, soft buffing. And then the doctors can use a cotton buff like that chair side anytime they need to polish that back up again, and just really softly go around it and shine it back up. If they do get plaque, they can take that goat hair bristle brush, the white goat hair, and go into some of those areas and remove it, and then go into the cotton buff. One thing that I really love about this material is the ability to repair it. And we all know how crown and bridge is. For those of you that are crown and bridge technicians, I love single centrals, but they don't always love me. It's complicated to get a single central for an out-of-state client perfect on one try, even with great photography. So with this material, we have the option to modify that chair side, which in my opinion is incredible where the future is going with this. I can take this resin and go right with the resin and add it to any area and repair it. So if that tooth is a little too pointy, if they chip off something, you can take the Flexera resin and just with a brush or a carver or even a little spatula, go in and add it to where you want and cure it in place. So we have the ability to modify, we have the ability to repair, which gives us the option to also adjust the occlusion. Now I'll warn you, if the occlusion is off by 2 to 3 millimeters, I don't recommend adding Flexera over the top of it and curing it in place. You absolutely can do it. I usually just rescan the new bite and redesign it with the correct bite. We just did a lower partial that was slightly out of occlusion on the molars. Our bite was off on the first go around. It's so easy to just rescan it and redesign it with the first one, move those teeth up into place and reprint it, instead of trying to sculpt honey 2 to 3 millimeters high. So this material is a little bit like honey. It will slump. So I encourage you to use gravity to your advantage when you're adding material on there. Use it so that it weighs, the gravity is pulling the material the direction you want to go while you have it under that light curing unit so that you can harden it in place. You can also add texture to it. You can add more stain to it. If it's not right, the doctor can shade it down in the mouth or add a little more detail. So I encourage you to have a lunch and learn with your doctors. Once you master this technique, sit them down and teach them how they can customize and repair and shine up this material. So it only takes a few minutes. And I also encourage you to teach the dental assistants how to do this. Sometimes the dental assistants love the little details like adding character more than the doctor can. And then that way they can quickly repair these and take care of it and maintain it throughout the life of the denture or the prosthetic, instead of needing to send it back to the lab or call you in to modify. So it's a very easy process. I hope that makes sense to you today. It really doesn't take a lot of work to add this color to it. And it's been exciting to see where the products have been advancing to over the years, over the last 2 years, in my opinion. It's really advanced. So make sure the main takeaways, make sure if you're modifying a printed material that you use composite stains internally and cover it with the resin itself. That will ensure that the denture or the prosthetic, the temporary, the crown, whatever it is you're working with, that it will wear the proper way that the manufacturer has recommended. It will reduce the stain, and it will also be less likely to hold porosity. It will have lower porosity and be less likely to hold plaque. One other really critical thing too I need to mention, we had a printed denture that we made for a really challenging patient. And this patient decided she would soak her dentures overnight. So do not soak this material. It will damage the material. Make sure your doctors know that. I encourage you to give a little instructions for use, packet or print out and send that with all of the dentures saying, warning, do not soak overnight. All they need to do is take out of their mouth. They can clean it with their toothbrush. If they're using toothpaste, make sure it's a light or non-abrasive, clean it and then let it air dry. If they soak it overnight, we've seen the palate start to crack over time on really large, wide dentures. I do love to use the printed dentures. I really like the option of using printed teeth. And when we in the past used the pre-manufactured denture teeth with a printed base, that's when we had problems. So everything now is printed teeth with printed base, so they absolutely bond and we have no separation with the material. So we're seeing a lot of advancements and there's more to come. But this year with the introduction of the Flexera Ultra Plus, being able to print final FDA approved crowns, it's really going to open the doors. So I challenge all you that are participating today, test the material, test the crowns. I feel like they're going to be a great fit opposing natural dentition. Give us feedback and let us know and help us refine this system together. I do feel that this is going to be a great option when opposing natural teeth. We'll have something that can wear a little bit softer, it'll be less abrasive, and it's bondable and customizable and repairable, which is huge for us because technicians are not great at perfection. We're great at repairing and fixing things. There's a couple Facebook groups I wanted to encourage you to go to. One is the Desktop Health Dental Users Group. It used to be the Envision One Dental Users Group. You're going to see other technicians posting some of their techniques on there. Remember, this is new technology. So it does take all of us on there voicing our opinions and our experience so we can help get that to the manufacturers and modify this material according to our needs. And also team up together to find new techniques and how to enhance and elevate these products. There's another one, 3D printing in dentistry group. I don't believe that's just desktop health related. I think it's overall 3D printing. I'm sure there's a couple other great groups out there, but I encourage you to take a look at them and join them so you can see what's going on and also ask questions if you need any help along the way. I do try to get on social media and help you out a little bit as well. You can reach out to us at capturedentalarts.com or office at Capture Dental Arts if you have questions, but I highly encourage you to speak to your representatives such as Zahn Dental and Desktop Health for additional help as they're the experts. So I just want to thank Zahn. They've been so supportive to let me be creative and offer this art class level 1 today. We will be offering another level that will go into advanced polishing and then advanced characteristics. So when we're creating complex single centrals, how do we stain them with Nexco? Just want to thank all of you for the attendees joining us today. And this video will be available for anyone who wants to check in later on. Like I said, I do have a YouTube video that has more in depth of how to add Nexco and customize Flexera. We will launch that live this Friday at Lab Day West, so anyone can watch it and download it. So I just want to thank you again. My name is Jessica Birrell, and I'm going to go ahead and open this up to questions, and we'll see if any of you have any questions that are waiting on.
Well, all of us at Zahn want to thank you, Jessica. This was excellent. I'm sure our attendees learned an awful lot from you from this level 1, the first of a few to follow now. So We do have one, and I think you answered it already. The attendee wanted to know if the characterization will fade over time or kind of crack over time.
Yeah, it will if it's applied topically. And that's the problem we had, is applying composites over the top of a printed material. They're two different materials. So the longevity is not the same with the composite versus the base. So you do want to use the same printed resin over the top to seal in any staining. So I can't stress that enough. Make sure if you add any composite characterization, keep that internal and add the printed resin over the top of it. I've heard some studies along that note of some people using clear printed material to go over the top of it, so it's a clear window. I have not tested that yet, but I can guarantee I will. And we'll also reach out to Desktop Help to get their opinion on mixing materials. You can mix any of the pink base material and the tooth material. You can mix those colors. They are the same resins, so they're just different shade variations. So there's no problem in mixing those different colors and creating your own. However, I don't know how it works using clear night guard material over the top of it, a night guard resin, or other products over the top of it. So be careful, and I'm sure we'll have a lot of people testing those things in the future and commenting on them.
Excellent. If anybody has any other questions, please type them in at the bottom of your screen and we'll get them over to Jessica to answer. If you do think of a question and we've already signed off, please don't hesitate to email us at Zahn Academy and we'll get them over. I think we have another question here. Any experience with one-piece dentures or always printing base and teeth separately?
Yeah, that's a good question. I love to simplify the process. And if you're printing the base as one and the teeth together, I know some people do that for a try-in. It makes sense if you're doing just a quick try-in. However, we found this technique with digital dentures is pretty precise. Our try-in ends up being our final. So we just go straight to printing base and teeth. And with the new Einstein, the process is so fast. Even with our Envision one, most time it's 15 to 20 minutes to print the teeth. The base can be about an hour to an hour and a half. So in my opinion, how long is it going to take to shade all of the tissue down? If your system's lined up right, I just print the base and the teeth separate and glue them together. And then I don't have to worry about trying to color the base to make it look pink if I print it all out of the tooth material. You absolutely can do that. You can print it all out of the tooth colored resin, take Nexco and try adding gingival staining and seal it in with a pink gingiva material. You can do that, but I feel like it's a lot more work to get the colors accurate. I think it's better just for a visual try-in if you're trying to get that color, and it's faster for you to just print it all in one color. So that's a really good question. I agree. For me, it's fast enough and the printing technology is so fast. I'd rather print it separate and glue it together. And like I said, most of those try-ins end up being the final. So we're simplifying our process. So we go from wax rim to final in one appointment, it's been awesome. So far, it's been 70 to 80% of cases. We're going from wax rim right to the final.